Hey guys, Dr. Joy Michelle Martin here with a very, very special someone, my friend and colleague, Dr. Kaylee Simmerman. And we're going to talk to you today about CBD oils, what it is, what it's used for, debunk some myths, because no, you're not going to get high. Even though that's what most of you are thinking, you can go ahead and admit it, you thought it. But we're here to talk about it and how it can help a lot of people with chronic pain, especially chronic pelvic pain patients. So take it away.
Absolutely. So first and foremost, I by no means am an expert. I do like to read the research, but I also base a lot of this on my experience and patient referral or patient testimonial on using the products. So CBD is a really fun, kind of new thing, but I think it has a lot of like myth around it. It's like mystical still, like people don't know what it is, where it comes from. So you say CBD, and the reason people think that it's still like that marijuana that makes you really high is because it comes from the cannabis plant. But it's grown differently. So it's actually grown in a way that have very low to almost no THC in it. So it does not have that psychoactive effect, which is why we're able to utilize it and it not show up to be THC positive, if that makes sense. So there's a lot of science behind it. I don't even know all of that. I'm not going to pretend like I know all of that because it's like a hot mess sometimes. But it's really, you can make it into any form you want to, but they pull it from the cannabis leaf and they make it from the seeds and then they push it out into the oil. There's lots of different ways that they can do that. And what happens is it introduces into the body, whether it's topical through your skin, whether it's sublingual under your tongue, whether you use it as a, and we'll get into this again later, but as a lubricant or something of that sort for pain. When you use it in that way, it gets into your body and it introduces itself to what's called an endocannabinoid, which is a part of your system. There's a system in your body, kind of like a neurological system, kind of like the cardiovascular system, that's called the endocannabinoid system. And for all of you sciencey people, I'm probably saying that wrong. I'm from the South, so I don't pronounce words appropriately. But it's that system there, and it's responsible for homeostasis, or in other words, it's responsible to help you keep your equilibrium so everything works like it's supposed to. And you have those already in your body, and all the CBD is doing, all of that, it just introduces itself to the ones you already have, and then they bind and make a stronger binding, which is going to increase the effect that we're looking for. Not the psychoactive effect, but specific effects that it helps, meaning like anxiety relief, stress relief, pain relief, and things like that. So that's really just kind of a quick introduction into what it is and how it works. I don't know how specific, Jay, you want me to go into that, but.
No, that was fine. I mean, you know, and just for a lot of you out there that may not know, it does, you know, like she said, your body does have these endocannabinoid receptors, and you know, they help to regulate a lot of systems in your body. So for people who may be highly anxious, or people who may be having a lot of pain, when it's broken into its ultimate, you know, final compound, these receptors, they'll just attach to the receptors, and that helps to, you know, act on different pathways that may affect pain in a positive way. So decrease your pain. Or it may help to bring a sense of calm. And a lot of that may have to do with the mix of endocannabinoids within the oil, but certainly because there's several different ones. And so there are different mixes and different, you know, compositions that you can, I mean, there's a whole science behind it you can get into. But ultimately, again, tetrahydrocannabinol is what will cause you to get high. That is from some weed, and we're not smoking weed. That's not what we are doing here. So
that's not the effect we're looking for. You're right.
That's not the effect we're looking for. So, you know, it's kind of like hemp. You know, everybody talks about hemp, but hemp comes from the same family of plant. And, you know, everybody, you know, people use hemp seeds. There is hemp oil. There is, you know, they use the fabric, the plant itself in textiles and so on. But it's from the same family, and you don't get high off of hemp. But certainly it does have benefits nutritionally. It's very high in omega, for instance.
Yeah.
And so it's something that we utilize. And similarly, we can use CBD like that without getting the negative effects, so to speak, because some people might like them, but the psychoactive effects of its counterpart. So its happier counterpart.
Yeah.
So what are some of the diagnoses that you would typically use CBD for?
So I use it a lot for, and you already kind of mentioned it, the pain aspect. I'm finding not only in the clinic, but just with myself, that it's giving a really good effect for pain relief. So I use it a lot for my clinicians out there, myofascial release. Instead of just using a massage lotion or an oil, I will actually use my CBD. I'm noticing quicker relief, and a lot of patients will report, I don't feel anything now, like as far as pain goes, or I feel much more relief. Or if I use it on myself, if I'm stressed, I'll use it on my upper traps and I notice pain relief there. But also arthritis. I use it a lot with patients who have arthritis, and I will recommend it to them, and they will rub it onto the joint, like right around where it's sore, and they feel an immediate relief. Now, of course, it's a temporary relief, just like anything topical. But if we can get any relief there with arthritis or any type of long-term joint pain, then absolutely we'll go for it.
Yeah.
So any pain like that, I use it, actually have been recently playing with it a little bit more for inflammation. So like around a sprained ankle or around an elbow that's swollen, something like that. Like that's been really cool to watch. I haven't visually seen a change with swelling, but patients will again report no more of the pain. They won't report feeling it stiff, anything like that with the swelling. So that's been cool. Use it a lot for migraines and headaches, a lot for anxiety. That's a big one. It's been like thousands and thousands of years that they have been using a CBD type like product for anxiety. It goes way back in the research, and it's been really fun to read about a lot of that, because I don't know why it's all of a sudden just now getting into our hands, but it's been really cool because for me specifically, I have generalized anxiety disorder, and I have a very type A personality. So I have a hard time handling a lot of things all at once. So I will use a capsule, a CBD capsule in the morning, and it really helps me get through my day. And they have the sublingual too, which is the drops under the tongue, and you just feel an instant calm, which is nice, but not a high calm. So you're not like getting all loopy or anything.
Right.
But you feel a sense of relaxation, kind of like when you're meditating, and then you feel more able to handle that situation. I have used it a lot with insomnia or patients that have a lot of trouble sleeping, whether it be from pain or just because they can't sleep. And they're seeing a lot of good effects there. And the research is showing a ton with neurological disorders such as multiple sclerosis. I have not in my practice seen neurological disorders, so I've been able to recommend it, but that's what the research is showing. But one new thing that I've been using it for, I've been talking to a company that I distribute with, and I've used one for myself, and then for patients have used it for painful intercourse. So that's been kind of interesting. So you can take a tincture, as long as it is pure CBD. Again, you want to make sure to check the labels, make sure where the company's coming from, and that the research is really good on it. But you can actually take it and use it as a lubricant so that sex is not painful or as painful. Yeah. So, because initially I think a lot of people are nervous about putting it in your body, and they're afraid to put anything internally. But if you think about it, it's just mixing with those endocannabinoids that are already in there, and it's natural as long as they're deriving it from the plant naturally. Because you have to.
And I think I'd read somewhere too with regards to vaginal insertion, just using it on like I believe it was a dilator when I read the article, putting the oil on a dilator and inserting it to help with pain and just, helping with penetration, the whole act of penetration, so that women are not having as much pain. And I think it's great because when we talk about like the opioid crisis and like what's going on in society, there are so many people who right now are getting hooked on opioids. It's ridiculous. There was a blog post that I'd written some time back, and I was doing some research on opioids and pregnancy. And like there are methadone clinics for pregnant women, and there are a lot of them. And it's really, really hard because then they're trying to track like what's happening to the kids, especially based on like, the outcomes based on how early they get the moms into these clinics or like, but then, and most people think, oh, well, mom was probably a crackhead, don't worry about it. But no, these are women who have had chronic pain, women who might have had things like lupus, women who might have had MS and are having flare-ups, different issues like that, a lot of autoimmune issues, maybe rheumatoid arthritis. So they're having pain, and they were placed on opioids well before they started doing any type of family planning or they got pregnant or anything like that. And now they're pregnant. It's like, okay, what do we do? Because they're taking all these opioids and but now they're pregnant.
Mm-hmm.
And so, you know, in lieu of that, like, this is such a wonderful alternative, because
Mm-hmm.
now you have something that's not addictive. You have something that's not causing, you know, some sort of adverse reaction to the system.
Mm-hmm.
I mean, it's been used, and a lot of the research has said it's been used for eons.
Mm-hmm.
Like, it's just now more or less coming mainstream. So why are we not using it?
I know. I've been asking that for a while. I think that, you know, we need to be utilizing it more, especially with the crisis that we have. And that's what I've been trying to push with my patients, is being an advocate for these other realms, these other options that are more natural and holistic. So even if it's essential oils or CBD oils, just something like that, and incorporating that and trying it.
Mm-hmm.
Because it's amazing, some of the stories that you will hear about, you will read about, like when you're digging into the research or just looking for information. There are so many testimonials about CBD being as effective as that if used properly,
Mm-hmm.
as an opioid, because if patients that are in that much pain, they're actually looking for relief, and they're going to use what gives them relief, not something that masks them, if that makes sense. And once they can tell that difference, it's a phenomenal effect. I think it's good. Yeah.
I've had two patients recently. And this is one of the reasons why I wanted to do this interview, because I've had two patients in like the last couple of months. One of them had MS.
Mm-hmm.
And I wasn't seeing her as a pelvic client, just as a private client. And she had MS. And, you know, we got to talking about functional nutrition, you know, recommendations for her diet, different things to help, you know, mitigate inflammation and things like that. And then I broached the subject of, you know, well, what are you doing for pain? What things have you considered? Have you thought of CBD oil? And she's like, actually, I go to a functional medicine specialist and they already suggested it. And I took it and it's really good. And I'm like, well, alrighty then. And I had another lady who was a patient with interstitial cystitis. And so, you know, for those of you who may not know, I mean, I'm going to give you like the dumbed down version. It's bladder pain. And so a lot of these people are in excruciating pain, more or less 24/7. And she was another one. It was funny because somebody had given them to her and she was already on pain medication, and she decided to take them one day and felt the best that she had felt. And so she says, Jay, so I got to tell you something. And she's like, so I took CBD oil. Don't judge me. I'm like, I'm not judging you. It's not, you can't get high off it. I'm like, it's fine. It's totally legit. And she's like, really? I'm like, yeah, it's totally legit. Cause somebody gave me these gummies, and like, you know, it kind of came across kind of secretive. Like, so somebody gave me these gummies, and I'm like, well, did they work? Did you take them? Yeah. And how'd you feel? I felt really good. I said, good. Keep taking the gummies.
Yeah.
And she's like, really? I'm like, yeah, take the gummies.
Yeah, absolutely. I think, you know, it's important to be able to find that too. It's just because the side effects, like there are none except something like dry mouth is the only one that they found as far as a side effect goes. There's a couple of cases that are showing an upset stomach, but I think it just depends. I mean, but the ECS system in most of us, as probably, this is not surprising to me and probably you either, Jay, but it's just our bodies are unbalanced most of the time. So what's the problem with adding a natural supplement to help? You know what I mean? Especially something that's going to help with the symptoms that you haven't found assistance with before. And speaking of multiple sclerosis, you know, it's calming the nerves down from the nerve pain that they're having.
Right.
It's not taking the disease away, it's helping the symptoms, obviously. But it's just anything that we can find that's more natural and a more holistic approach, I'm all for it. And that's why I advocate for it. And I think that it is something that needs to be talked about more often. And I'm glad to see that we are starting to talk about it more.
Especially for chronic pain patients too. I mean, because these people, in most cases, you know, we're not going to cure their disease process. You know, we're not going to take away what it is that's affecting them. In some cases, we can have great enough change that they can go for a very long time, more or less symptom free or with minimal symptoms. But for a lot of these people, they wake up and they're in pain morning, noon, and night. And so, you know, if we can, like you said, if we can offer a solution or just something that helps, that doesn't have all these negative effects, then why wouldn't we, you know? And so I feel like it's a great conversation to have, and to continue to have, to start bringing more awareness, because there's still a lot of people that, you know, are like, no, I'm going to get high off of that. Or there are a lot of people that are, you know, there's still this huge stigma around it.
Yeah.
And it's like, no, it's okay.
And the way that I describe that too is like, if you go back and you read about how they make CBD oils, you'll see that there's kind of two strands from the cannabis plant. One strand is kind of considered the drug side. That's the THC side. That's the kind that people get high on. The other kind is the hemp plant. The hemp plant that's pulling from the things that have very low to no THC. Now, there is a legal amount of THC that can be in some of the products, but it's not something that's going to affect you psychoactive by any means. Like, it's so low, it barely even makes a difference. The reason that it's there is because it's in the same plant. So I think understanding that is important. So what I usually start with my patients is I'll just tell them, you know, like, there's two different, like, there's a plant. And there's ways that they pull out the CBD oil, and they can make it for a drug purpose, or they can make it for the approach that we're going as far as that natural effect, which is where it's going to have really low or no THC. And when you're pulling from the hemp plant like that, they do test it for THC, which is important for you to make sure that the products that you're looking at say that. Because it's overwhelming when you type in CBD oil, you're going to get thousands of options. And everybody's going to say they have the best product. But one of the things I always recommend is look to see if they have research on their website and see who did the research. Where does it come from? Are there articles on there? Are they talking about how they make the CBD oil? Because if not, a lot of times it's because they're hiding something, or they don't know that, you know, or they just don't produce it for whatever reason it is. I've reached out to some and I ask them, you know, like, how do you do this? Some of them don't put it up there, but it is what it is. And then, like, paying attention to what kind you want, because I know a lot of people prefer the gummies. Some companies don't carry the gummies, so you have to go to another one. I like the sublingual and the capsules, so I use a different company. So it just being able to pay attention to those, but the important part is to figure out how they make it. Because there's also differences between, like, so much information out there. I get really excited about this. I'm such a nerd. It's like there's two kinds of it too, where it's like an isolate, which is where it's pulled from only one part of the plant. Or you can get a full spectrum, which is pulled from the entire plant. They use as much of the plant to make that oil as they can. And I know it seems that you would want only one compound, but the effect is going to be more beneficial from that full spectrum.
More balanced.
Full spectrum CBD oil. So you always want to search for those things and kind of pay attention to how they're made, where are they created, and look at that, because everybody's going to try to make a product and say it's the best. So you got to be careful about it.
Yeah, absolutely. And now what brand do you typically use, or have you found useful for you and for your clients?
Yeah, so I've tried two that I've actually really enjoyed. So I use TheraMu as one brand that I use, and I use them because their balm is mixed with an emu oil, which helps 7 times, I think it's something like 7 times more effective with getting through the skin. So it's emu oil, which is mixed with the CBD oil. It's a very effective balm. I use it for pain relief. That's what I use for, like, cesarean scars, scar tissue releases, anything like that. As far as my capsules and my tinctures and the other products, I use a company called Functional Remedies. They're very good. They have a lot of, they have a lot of different brands, not brands, but like subsets, I guess, from what they've created. And they're so easy to talk to. I've loved the customer service from both of those companies. I am currently looking into others just to see what I can learn about them, because I've recently heard apparently that they make coffee with CBD in it, which is interesting. So I'm like looking into all these other avenues to see kind of what else is out there. So those are the two that I use, though, and that I recommend with my patients.
Nice. I think that's great, because like you said, I went looking the other day and I'm like, brain overload. CBD oil. Okay.
Yep.
Lots of people. And then the other thing is that can be confusing for a lot of people. The price variance is, I mean, it's huge. So you've got all these companies on the market, and I know a lot of time people are going to be tempted to say, well, this one costs less than this one, or, I can get this one on Amazon. But again, you guys got to be mindful of the quality of the product. You know, look for any quality assurance that they've done, research, really details how they're refining it. You know, make sure that you have all that information there. And I'll post a link to the blog post that I've done on the CBD oil as well. But there's a lot of information out there. Just make sure that you're getting wherever you're getting it from a reputable source. I mean, that's key.
And if you don't know, reach out to someone that talks about it on social media or that you know personally that uses it, and just say, hey, who do you use? Why do you use them? And always ask why. And most of the sites will have a little option as far as like which one is right for you. That's always a good sign too, so that you can talk to somebody and say, hey, this is what I'm dealing with. I'm having a lot of migraines. Because when I had called initially about that, they actually recommended like mixing the tincture with my balm and putting it here on my temples. Very effective. It actually helped. It helped to relieve the headache quite a bit. And I was just like, I was impressed that they took the time to tell me how to use it. So finding those companies that are willing to work with you, because again, everyone has a different symptom that they're using it for. And if they can't give you a good reason as to why it helps, or that it will help because of this, this, and this, instead of just selling it to you, then you probably want to think into it a little bit more. But it is important too, as far as the pricing goes, a lot of times you will have to pay more for quality. And that's okay, because you want the right product. You don't want to put something in your body that you don't know where it comes from. These super cheap ones are the ones that you can buy like 6 for 1 type thing. Like those are probably not the best option, because they're trying to get rid of it for a reason at a low price. So you want to really pay attention to that, make sure it's quality. And that's important. So
yeah. So guys, there you have it. Your intro to CBD oils. Now, Miss Kaylee, if they need to reach you, my little Southern self, I've been down here a while when I start calling people Miss. If people want to reach out to you, how can they do that? Where can they find you?
Yes, I am on Facebook and Instagram. You can search my name, Kaylee Garrett Simmerman, or Dr. Kaylee Garrett Simmerman, physical therapist. And then on Instagram, I am at KGSimPTDPT.
All right. Awesome sauce. And I will put all that information, post that with the video. Well, I want to thank you so much for debunking like a lot of the myths and a lot of the, notions, negative notions, especially around using CBD oil, and know that we can do a lot for our patients, whether it's, especially in pelvic health and women's health. A lot of these women, again, are dealing with chronic pain. So whether they're taking it topically, whether they're taking it orally or whatever have you, or internally, via, vaginal suppositories or whatever have you, there are a lot of ways that this can be a helpful alternative to a lot of the other medications that these women may be having that are giving them so many crazy side effects. So I look forward to hearing more and all the other research that's yet to come on CBD oils. So, all right. Well, thank you so
much for having me.
Thank you, and take care.
You too.